afternoon, everyone. Welcome to
This meeting is being recorded.
third session of this webinar series. My name is Munira. I'm with Early Childhood Authority here in Abu Dhabi. And as some of you may know, this webinar consists of 5 sessions focusing on the key to effective early childhood intervention. So today's session will be on family participation in the early childhood intervention process. If you prefer Arabic language, please choose the Arabic channel to hear the interpreter. You will find it at the bottom of the screen. إذا كنتم تفضلون اللغة العربية تقدرون تختارون قناة الترجمة الفورية تحت للاستماع إليها. And if you would like to receive the certificates for this webinars, please make sure to join. You have joined the 4 sessions, and please type in your name in the chat if it's not as your name already. I hope that's clear. So please, everyone, welcome Dr. Toby. She is a professor in the Department of Pediatrics and the Director of Professional Development at the Georgetown University Center for Child and Human Development. Over to you, Dr. Toby.
Thank you, Munira, and good afternoon, everyone. Happy to be back for our 3rd week together. Hopefully some of you have been able to make it all 3 weeks and will be with us again next week. But today we're going to start really talking about what your job is within the early intervention process. We really believe that in order to make an effective change with children, it's really important that families are partners with the providers. And today, we're going to talk about how you can be a partner. There are 4 key elements or 4 skills that we'll be sharing with you today that I think will help you feel much more comfortable partnering with your early childhood providers and being able to feel like you're an equal member of the team. We're going to talk about creating an echo map, which will help the providers understand your family and your network. We're going to be talking about how you contribute to the creation of the individualized family service plan or your intervention plan. I'm going to talk a little bit about how what you can do to participate effectively in each session, no matter if it's with the speech therapist or the physical therapist or the psychologist. Your ability to feel comfortable participating with them is key to the success of the early intervention. And then we'll also talk a little bit about what you need to do to document how well you think your child is doing with the services that are being provided. But before we do that, I want to give you a little bit of an update from last week. Those of you who were with us last week realized that we weren't able to get through all the material that I had planned. So I want to just bring us all up to date a little bit about what was included in the slides and sort of the key concepts that I wanted to make sure that you took home. So first, we talked about the difference between developmental delay and developmental disability. Understanding that a developmental delay is temporary. Some children will catch up and they will no longer be delayed. But if a child continues to show some developmental differences between their performance and their peers after the age of about 5 or 6, chances are they have something much longer lasting that could be considered a developmental disability. And then we talked about some common characteristics of common developmental disabilities. We talked a little bit about autism spectrum disorder, intellectual disabilities, cerebral palsy, attention deficit disorder, learning disabilities, communication disabilities, and some disabilities that may be considered social emotional or have a behavioral component to them. And in your slides from last week, we have all the major characteristics of all those very common childhood disabilities. what we missed out on talking about was how we figure out how a child has a disability or not. And I was going to explain to you that there are 3 processes that professionals use to help identify a child. One is something that maybe all of you have participated in at your pediatricians, when your pediatrician screens for a child's development to make sure that the child is meeting their developmental milestones. A screening will only tell you if a child is perhaps having some issues. And if a child is having difficulty on the screening, then they would be referred for an evaluation. An evaluation is a very comprehensive collection of information. Most often, children who are suspected of having a developmental disability will be seen and evaluated by a variety of people. People who can look at their cognitive abilities, people who can evaluate their motor abilities, be able to assess their medical status, their language abilities, their behavior. And based on the evaluation, we can often determine if a child has a specific disability or not. And once that has been accomplished, more information is collected as we assess the child, how they use those abilities to meet their needs on an everyday basis. So an assessment is the information we use to help develop a service plan. We want to know what a child does on a daily basis, how they do that, and if anything needs to be changed in order to help them become more efficient, more effective, more successful. It's not enough just to know if they have a certain diagnosis or not. We really do need to know how they perform in their environment and what the expectations are of the environment to see if they're meeting those expectations. And then finally, the other topic that we weren't able to talk about last week is what do we have available to help children become more successful in meeting expectations, those intervention approaches. And there are lots of different intervention approaches. There are things that focus in on a child's behavior. There are interventions that help them perform in a classroom situation. There are interventions that help them relate to different people. There are interventions that build their language, build their motor skills. There are also things like surgery for children with cerebral palsy. There is medication. Many of you and many of your children probably take medication if they have attention issues or if they have seizures. And then there is a whole host of assistive technology that kids can use to help them communicate, help them do activities of daily living, help them do schoolwork. So there are many different kinds of interventions that your providers may pick and choose to use with your individual child, because all the interventions that we do use with children should be based on the individual needs of each child. Each child's interests, their behaviors, and the concerns and priorities of the family. And we're going to talk a lot about that today. But no matter what type of intervention you and your team decides to use, and I'm sure it'll be a combination of many different interventions, we want to make sure that they've been started as early as possible. So as soon as we suspect that a child may have a disability, we want to start the process of intervention. We don't want to wait and see. Remember, the very first week, we talked a lot about how the brain is developing rapidly in the first 3 years of life. Well, we want to take advantage of that rapidly developing brain and give kids the intervention that they need to help the brain develop in a way that's going to be most successful for an individual child. We want to make sure that the kinds of activities that we do with children are based on what they're interested in, what they show us they would like to do. So we want to be individualized. We also want to provide services at an intensity that will increase the likelihood that they will learn from our interventions. That does not mean that we have to see, the professional has to see a child often. What it does mean is that the professional needs to support you as family members to include the child in everything that you do in a way that is therapeutic for them, or will be done in a way that improves their status. So that intensity is not necessarily the time with the professional. It's really the time that the child is doing things that you want them to do. All intervention is very systematic. So you want to know why the therapist or the provider is doing what they're doing, how they're doing it, and in what sequence they are doing it, because we want to make sure that we understand how the child is responding. Your involvement in that process is key. And today we're going to talk about how you share the information you have about your child and your family to make sure that you're involved in a way that you feel comfortable and confident to work in partnership with the providers. So before we go on to today's topics, does anyone have any questions, concerns, any ideas that you want to share with your colleagues? Well, if you do, as we get going, I would really appreciate any time you asking any questions that you have, making any comment. You can share what you know. I believe wholeheartedly that as family members, you know a lot. You have really learned a great deal over the years that you've spent with your child, and your child has spent with many service providers. And that learning can help each other, and certainly can help me as a provider to be a better provider. So sharing that kind of information and your perspectives on services is really, really important. And we're going to talk about that, how to best do that within the system of early childhood intervention. So something that you want to remember as parents is about parents. So parents participate in early childhood intervention. They are actively participating in the process, and they are engaged. If you're going to a provider who has you sit in another room while he or she sees your child, that means you're not participating, and you're not engaged, and you're not active. And it will perhaps diminish the effects of the services that you're trying to provide to your child. So you want to be participatory. You want your child and you as a family unit to be accepted and included in the community, in all the activities that you're interested in doing. The supports and services, or the rehabilitation services, the intervention services you receive should be responsive to your needs, because we want you to be empowered to share information, empowered to make suggestions, empowered to give your opinion. When you're able to do that, you're respected. And again, it helps you. We all want to be respected within the partners that we work with. Parent-to-parent support is really important. Over the years, research has shown us over and over again that families of children with disabilities or educational difficulties really find support from other parents. Even if they are closely aligned with their providers, they will go to other parents for support. Other parents that have a child with a similar disability, or just other parents in general, because parents to parents are able to share those day-to-day difficulties that we all experience as parents, and also our celebrations that we all experience every day. I mentioned we want to be individualized or tailor-made. So PARENT is tailor-made. You want those services and supports to meet your unique concerns, your unique priorities. And finally, we want you as a parent to feel comfortable within your community. We want you to feel comfortable with your child with a disability within your community, the whole community. Not just the community of people with disabilities, but the whole community. We want to make sure that all children grow up in a community that they feel valued, respected, honored, and included. And that starts with you feeling that you're included also. So we want to keep that in mind, that what it means to be a parent. And as I mentioned, I'd like to talk to you about 4 skills that you can develop that helps you be part of the early childhood intervention process. Just because you're a parent, that doesn't mean you know or feel comfortable in what to do with your team. You may feel very comfortable, very competent with what to do with your child because you know your child the best, but you may not feel as comfortable with the providers who are professionals, who you have been told to go to for some special reason. But in order to create a partnership with those people, I'm going to propose that you learn how to do 4 things. Creating an echo map with them, developing your intervention plan with them, participating in intervention, and documenting how effective the intervention is. So let's chat first about an echo map. Some of you may have heard about an echo map. Perhaps some of your providers have actually drawn an echo map with you. For some of you, it might be completely new. An echo map is a visual picture of you and your family and the community supports and services that you and your family use on a regular basis. It helps us as providers understand, and it helps you as families, helps all of us to understand the relationships between family members and services and supports. We need, as people in the world, we need to count on other people. And some people are more count-ontable than others. We know there are people in our lives that we can count on more than other people. We know there are some people in our lives that entertain us more than other people. Those people that we count on to help us are people that the service providers need to know about. So they may be able to help them help you, or help you share what you need from them. There are also people in our lives that we know are not very helpful, that actually may create more stress for us, that may be very, very difficult to interact with. And it could be a relative, it could be a physician, It could be a therapist, it could be a teacher, it could be a neighbor. We need to know those people too. And you need to know those people. So you'll know that you won't count on them. The provider won't suggest to you to go to somebody who you know only creates more stress for you. We want to help you go to the people in your life that are supportive of you, that will help you and your family become more successful. So it really does create a visual map of the relationships that you have with a whole host of people, professionals and informal supports. People who have done echo maps over the years have found that families find more comfort, more help in a lot of ways from the informal supports they have, from perhaps a women's group in the community, perhaps a group at the mosque, perhaps the people you visit, you see every day when you take your child to the playground. Those kind of people are really, really helpful to know about, because we want to make sure that you are feeling good about the people in your lives and being able to identify who makes you feel confident, competent in providing services and supports to your own child. An echo map also tells us which of the professional services you find most helpful. Some of you, because of your child's disability, your community may be hooked up with a variety of services. You may be involved with child protection. You may be involved with the medical system. You may be involved with the special education system. You may be involved in social services. Some of those individual people who serve you may be more helpful than others. We all know that physicians may be helpful or may not be. Our pediatricians tend to be very helpful, but the orthopedic surgeon may not be as helpful. So you want to know that. You want to be able to identify that so you don't go and ask somebody for something that they cannot give you. And that's the same with your providers. You may have an occupational therapist providing services to your child, a speech language pathologist, and a physical therapist. Many families do. You may get along great and really feel that the occupational therapist is very helpful and the physical therapist is very helpful, but you may not think that the speech language pathologist is all that helpful. Even though your child may need support in learning to communicate. The other providers may be able to share with the less helpful person on how to be a better help to you, or share with you what you need to ask of the less helpful person to get what you need for your own child. So this is what an echo map could look like. You could be very messy, like this one, that it's just handwritten, or it could be less messy, but still complicated. And the family is here in the middle, and all these boxes are all the people in the life of Kevin, Sarah, and Michelle, a 2-year-old. Some of them are neighbors, some of them are grandparents, some of the people are colleagues of the mother and father, family members of the mother and father, and certainly all the service providers. This family happens to get a home visitor, they get physical therapy, speech language pathology, and pediatricians. The lines indicate how helpful Kevin and Sarah find individual people. So these really dark lines tell us that Kevin and Sarah as parents really depend on the neighbors, the Johnsons, Sarah's parents, and her sister. They are very, very helpful to her. They also find that the home visitor is very, very helpful. Less helpful, but some help are Sarah's colleagues on being understanding to her, the physical therapist and the speech language pathologist are sort of helpful. People who are not helpful could be for a whole host of reasons are the father's parents and the pediatrician. And it could be that they don't have anything to offer the family, or the grandparents could be far away and not being available to them on a regular basis. Or they could be very helpful to the father, but maybe Sarah, as the mother, finds that her in-laws are stressful for her. But you draw the pictures with the lines that connect everyone to see those relationships. So, it can be done in a whole variety of ways. And it certainly would help you understand all the people in your life and to share that. So when you want to count on someone, for example, who do you think Kevin and Sarah would go to if they needed help at the last minute? They needed a babysitter at the last minute, or they needed somebody to pick up some medicine for the baby. Do you think that they would ask the speech language pathologist to do that? Probably not. They'd probably go right to Sarah's parents or her sister or the next door neighbors to find out if they could do them a favor. So how do you create an echo map? And if any one of you has participated in the development of an echo map with your providers, I'd love you to share your experience with that and what you felt about it. But basically, you create the echo map by having a conversation, by having you as a family share information about your family and about your friends and about your community. And the providers draw the picture as you're telling them. And they may ask you questions as things come up. They may look at your body language when you talk about your in-laws, and they may see that the dad may see that the father really thinks his parents are very helpful, but they see you as a mom rolling your eyes and saying, oh, they're not very helpful to me. And that's really important information. And that provider, through this conversation and really observing how you talk about your services in your community, really are able to develop a really rich picture that they can use and help you use as you move forward. You want to make sure you give information about the immediate family, how helpful or not helpful they are, your extended family. And I know that in your culture, you may have very extended families. My family is very small, and we don't have a lot of aunts and, well, we have lots of aunts and uncles, but they're not in close proximity, so they're not particularly helpful. But you probably have extended families all living close by. You also want to talk about the formal services and supports, and not just the therapies, but other formal supports. Perhaps if you're going to some sort of a parent training program or a counseling program, things that you may be receiving that is helpful or not helpful. And then informal supports. And as I mentioned, we often underestimate the importance of informal supports. Informal supports can be as helpful, if not more helpful, than all the professionals in our lives. And families tell us that over and over again. So I think I sort of talked about all of these things, you know, the people who are living with the child, especially the mothers and fathers, families, and other caregivers. Again, your culture tends to have, families tend to have many caregivers. You may have a nanny for the children, you may have a housekeeper, you may have multiple nannies, depending on how many children you have. Those people are really important. And if they aren't helpful to you and your family in helping your child be the best that he or she can be, then we need to know that. We don't want the therapist working with the nanny who isn't very helpful to you. So we want to make sure that we understand those relationships and what your expectations would be for the different kinds of people in your life. Neighbors, family, friends, don't underestimate coworkers. I am very, very fortunate that for the last many years, I've worked with wonderful people who I do feel I can count on if something went wrong in my family. If I needed something, if I needed advice, if I needed support. And I think for most of us in my work environment, we all feel very similar. So hopefully you feel that way too. And those work colleagues can be really, really supportive, especially if something happens during the workday that requires you to leave. Friends, neighbors, school friends are really important. Probably all of us have experienced the children's parents, our child's friends who they meet when they're in first or second grade. Their parents all of a sudden become our friends over the years. And sometimes our children are not friendly with the kids anymore, but we stay friendly with their parents. So that's very, very important. It's very important when, as children move into inclusive environments, that you have friends of parents with and without disabilities, of children with and without disabilities, not just families of children with disabilities. And as I mentioned, community groups and the professional supports, those therapists, those doctors that you work with on a regular basis. And some of the information that helps us understand your relationships with these various people are things like, how often do you see or talk to them? Even if you may not see the grandparents very often, you still may have a really strong relationship, and you may really think that if they are needed, they would come immediately. How well do you get along with them? And I think that's really important. We cannot assume that we all get along with our family members well. You know, we can choose our friends, but not our family. And just because they're our family member, we may not like them. They may not be particularly helpful. They may not be particularly available to us. So you want to be honest with yourself about how well you get along with them. Who is the person you would call if something really neat or cool or surprising happened to your little child? Who'd you call to tell? Who do you want to share that information? Who do you share the first time your child took a step or said mama, or did well on a test in school? There's probably some person in your life that they would be the first person you would go to. And we want to know that. And as I mentioned, the professional will observe your body language when you're talking about these various people. And the professional will also ask you to explain why you find somebody helpful and why you find somebody not helpful. We don't necessarily want to know the details of your relationship, but being able to articulate what they do for you that you find helpful or not helpful is really important on understanding what you could ask of them. The key is we all have people in our lives, and we want to know who is supportive, who is stressful. And we want to avoid those stressful folks, and we want to gravitate toward those supportive folks. Our service providers want to know that information too, so they can help you, guide you to those supportive folks. So just take a few minutes right now. You don't have to share this information, but I want you to sort of think for yourself, who do you find helpful in your life? Who can you count on? And who do you find not very helpful? I think that sometimes is the harder question for all of us. We have lots of people in our life that are very helpful to us, but who are those people who are not very helpful? Okay, so that's the first thing that you could do with your providers to help you feel comfortable in partnering with them, and most importantly, to help them know about you to feel comfortable partnering with you. We feel very strongly when we talk about family involvement, we're really talking about an equal partnership. We want you to be involved in what we're doing. We want you to share information. So creating that echo map within that conversation is one of the very first things that really opens up opportunities for us to develop that partnership. That often leads to the development of our intervention plan. In the United States, in early intervention or early childhood intervention in the United States, we call that plan the Individualized Family Service Plan, or IFSP. I don't know what you call it in the UAE, but it's probably something similar to that. These plans all have certain things in common, no matter what it's called. It's written, and it describes what early intervention services you and your child will receive, who will deliver those services, not just the profession, but the person, what her name is, what his name is, where those services will be delivered. Will it be delivered at home? Will it be delivered in childcare? Will it be delivered during the grocery shopping? Remember, we talked about delivering services within naturally occurring learning opportunities. Those kinds of things, the home, the childcare, the playground, the grocery store, the swimming pool, the mall. A natural learning opportunity is not the clinic. So we want to really detail where the services will be delivered. And the fourth component of a document or a plan is, how will we know that these services are successful? And that's pretty important. Many times children with developmental disabilities, because we know that they are long lasting, receive services all the time. The minute they start receiving physical therapy, they receive physical therapy forever, until usually the child says they don't want to go anymore. It's not, we need to base when we provide services, how we provide services, where we provide services, how often we provide services, based on how successful those services are, not just because the child has a disability. So documenting how will we know if the services are successful is really key and really does require you. I may have an opinion on what I think would be success, but I really want to know what you think is success because you're the parent. This family plan relies on you as parents. We cannot, as parents, just accept what the professionals tell us and just have them write a plan and say, oh yeah, that's a good idea. We need to articulate what our priorities are, what our concerns are, and what we would like our children to do, not expect them to know what it is. Any plan will have lots of information. It'll have information about the child's development in different areas of development. It will have family information. It'll have some information about you, not particularly sensitive information. It'll be, your name and your address. Clearly, it will detail what outcomes you want to focus in on, what you want a child to be able to do over 3 months, over 6 months, that you will be able to say, if he does that, if she does that, services are successful. What services a child needs in order to reach those outcomes, what other services in the community you may find helpful. If a child is learning how to walk, it may be really helpful for him to, yes, receive some physical therapy, but also to go to the baby gym class where they'll work on motor skills that with other children. It will tell us how long the services will last. We in the United States build in every 6 months, we have to reassess to determine if the child still needs our services. But it could be that you'd want to reassess them in 3 months or 9 months or a year. And as I mentioned, where and when the services will take place. The more your providers provide services to you in those naturally occurring learning opportunities, the more important it will be to delineate where and when. If you're having difficulty with your child in the grocery store, the plan has to say that the therapist will go to the grocery store with you when you plan on going grocery shopping, not when she's planning on taking you grocery shopping. When do you usually go? Do you go to the market every morning? Or do you go in the afternoon once a week? Whatever your routine is, the provider will want to accommodate to that, not the other way around. So as we move more and more in those natural environments, it's more and more important on delineating when and where the services will take place. And that's very nice that we have all this information on a plan, and they're usually very detailed plans, usually very long, because there's lots of information. But what do they really mean, and what do we really want when we read the plan to understand? First, we want to make sure that whatever services and supports are written on the plan, they are meaningful to you as a family. Just because somebody says that you need physical therapy, if what that physical therapist is doing or planning is not meaningful to you, you do not need to see the physical therapist. Whatever they're doing, you want to make sure it's meaningful to you. You want to make sure that the providers that are listed in the plan, that are willing to work with you in partnership, in equal partnership. Not tell you what to do, not to do for you, but to really support you in doing for yourself. As we all grow and develop, that's what we want to do. We want people to support us so we know how to do for ourselves. And that's a true partnership. The services should reflect learning and development enhancing opportunities, those naturally occurring learning opportunities. You should see on the IFSP or the plan that says services will be, if we want your child to play in the playground, the services are going to be in the playground, because those are the learning and development enhancing opportunities for the child. Most importantly, the plan represents your concerns and priorities. What are you concerned about? What are you prioritizing? Your child may have difficulty in talking. He may have difficulty in behaving. He may have difficulty in walking. But really, you're most concerned with him sitting at the table and eating a meal with the family. That would be what we would want to work on, because that's the behavior you want to address, because that's most important and most meaningful to you at that particular time. At another time, it could be walking. Just depends, but at that particular time, you have concerns and you have priorities. And learning how to articulate them in a very functional, objective way is very, very important. We want to make sure that the therapists or the providers are giving you ideas that are fun, that engage the child, that are based on his, her, or their interests. Next week, we're going to talk about activities, really practical, functional things you can do on home. And we want to make sure that they are fun, they're interesting, they're engaging, and based on the interests of the child. That's really, really important. And the bottom line is that this plan needs to represent that partnership. It does not need to tell you what to do. Too often over the last many, many years, providers tell families what to do. You need to go get physical therapy. And the physical therapist tells you, you need to bring him to see me twice a week. You need to buy this kind of a toy. You need this kind of a situation at home. You need to do this. All those things may be really helpful. But it might be even more helpful if you can if they help you figure those things out for yourself. So when you know that he's not as interested with that toy as he was 6 months ago, you'll be able to figure out what toy he might be interested in. So being able to learn how to figure out and solve your own challenges is much more important than somebody telling you what to do. One of the things that's most important on any plan, probably the most important thing on a plan, is the outcomes. What is this all leading to? What is the child going to do that he's not doing now by having these services and supports? As I mentioned earlier, the outcomes need to be meaningful to you. You need to think that this is what I want the child to do. They need to be written in a way that you understand. No professional jargon. You want a very simple language, clearly tells you what, when, where, and how, that you understand. As I mentioned, it needs to reflect your priorities. Everybody has a long list of things we want to change. Let's prioritize them. and think about what we want to see changed in a specific amount of time. Think about it in chunks. What would we consider a success if a child was doing something in 6 months that he's not doing now? Would he be eating with a spoon in 6 months? Would that be really important at breakfast when I give him his cereal or his oatmeal? He's not doing that now. Is that something that's important to you? Really something that we can all picture and we'll all know if he reached that outcome. So instead of saying, I want him to talk, which oftentimes families do tell us, you want to say things, I want him to say milk when I offer him a cup of milk during mealtime. So we know we want him to say the word milk. I need to offer him milk, and it has to be done within a mealtime where it makes sense that a young child would be drinking a cup of milk. I want him to sign more when he wants more food or a toy. If we're teaching somebody sign language. So that's very clear than just saying, I want him to talk. Saying I want him to talk can mean 1,000 things to 1,000 different people. Instead of saying, I want him to stop tantruming, we want to be very clear and say, I want him to walk out to the car holding my hand when we need to leave for school. Many of us experience this sort of the child who tantrums in the morning when we're rushing to get out the door. We often hear from families that just say, I want him to stop doing that. That's not particularly helpful. We all want to stop doing something bad, but what do we want to replace it with? We want to replace it with something that they do. So we want to articulate what we want the child to do, not what we want the child to stop doing. If the child does more things that we want him to do, chances are he's doing less of the things we don't like him to do. So these are just some examples of how we would want the outcomes written. And they may not sound like the outcomes that you have received from your therapist. We would prefer you to say, Amani will walk from the living room to the kitchen when called. When I say, Amani, come here, she will walk from the living room to the kitchen. A therapist may write something like, Amani will ambulate 25 feet with a reciprocal arm swing. That doesn't mean very much to families. We don't know what 25 feet is. Why does she need a reciprocal arm swing? And what is ambulate anyways? We want to be plain and simple and have us all have the same picture in our minds. Abdul will sit without support and play with his blocks. Rather than Abdul will maintain an upright sitting position for 3 minutes. Again, we don't know what that means. Abdul sitting without support and playing with his blocks is very functional. That's what children do. They sit on the living room floor and they play with their blocks. They don't think about maintaining an upright sitting position. Aisha will pick up a piece of toast with her fingers during breakfast, rather than Aisha will improve fine motor skills. Ishmael will scoop his oatmeal with a built-up handled spoon during breakfast, rather than he will feed himself independently. This is especially important when children may have a great deal of difficulty and need assistive technology. You want to make sure that you clearly indicate in the outcome if they need to have accommodations or modifications or use technology to make to meet the expectation. In this situation, this little guy needed a spoon with a built-up handle to make it easier for him to grasp it. Jamila will say Dada when he walks into the room and gets her attention. very clear. She wants him to say something that's meaningful to the person that it's meaningful. We want the dad to get her attention so that Jamila will respond to him when he walks into the room, rather than imitating 4 to 6 consonant or vowel productions in 3 of 4 opportunities as judged by the speech language pathologist. So those are just some examples of what we prefer on my left of the screen. But the ones on the right-hand side of my screen are probably the ones that your therapists have written for you. So, when you go back next week and you're meeting with your therapist, say, I really want to understand what this means. And I'll tell you what I would like him or her to do when I'm at home with them, and what would make me really happy if he could do, and tell them what you want, rather than just accepting their more professionally oriented outcome writing. So you're going to work with your therapist to develop an echo map to help you understand the supports and services in your life. You're going to participate significantly in the development of the IFSP, really indicating that you are leading the process, that you are engaged, you are the driver, you're telling your concerns and your priorities, and the professionals are helping you write this document in a way that everyone finds very helpful. The third thing is participating in these activities and how you learn to participate. Most of us have learned to be very passive when we're involved with professionals, no matter if it's an attorney, if it's a physician, or our car mechanic. They're the professionals. We go and meet with them and we shake our heads. You probably have all done that. But when you're working with professionals who are, their job is to help you, you need to be a little bit bolder than that. And I have 3 key activities that will help you be a better participator in your services and supports. 1, understanding that you're part of the team and feeling comfortable as being an equal member of the team. Sharing information on an ongoing basis, not just in the echo map or the IFSP, on an ongoing basis, and being able to be very reflective in identifying your concerns and priorities. Sometimes families, want everything. We all do. We all wake up on New Year's and say, we're going to lose 5 pounds. We're going to go to the gym every day. We're going to stop watching television, and we're going to take a walk every day. And you know as well as I do that we don't do any of those things. But it may be more helpful for us to think, well, of all those things that I want to do, maybe I could stop watching TV for 2 weeks. And that could be my priority. I would put all my attention on doing other things other than watching television. And once I've been very successful at that, I'll add some more things because I'll know I'll be able to do it. But doing all 4 of those probably will be not very successful. So learning how to identify your concerns and priorities and articulate them in a meaningful way is really important. So what does it mean to be part of a team? Well, first, this is going to sound silly, but I think it's really, really true for many families. When you have a child with a developmental disability, say one of your children has autism spectrum disorder, chances are you have a speech language pathologist, you have an occupational therapist, You may have an applied behavioral analysis therapist, and your child may be in a preschool classroom. I want you to really think about how much you know about those providers. Do you know their name? Do you know which one is the occupational therapist and which one is the speech therapist? Do you know where they went to school? How they approach their work? They are serving your children, the child you find most precious in your life. You want to really know them. I have met so many families that have no idea who they invite into their home once a week. They trust whoever this young woman is doing their job. They don't know if it's the speech therapist, they don't know if it's the PT, and oftentimes, if they know their first name, that's good. They rarely know their last name. I don't think that you can really feel part of a team if you don't know any of these people on your team. They all know about you. They know your name. They may know how old you are. They know where you live. They know where you work. They know about your family. You should know some about them too, because you're developing a very trusting relationship. You'll know that it's helpful of knowing about your providers if they answer your questions and concerns to your satisfaction. You are able to ask them in a way that builds on their expertise. You are comfortable in making suggestions to them. You feel comfortable saying, my little guy really doesn't like playing with trains. I don't know why you're always bringing trains, but he'd rather play with pickup trucks. So some of us feel more comfortable than others. You want to get used to feeling comfortable. And your providers need to help you feel comfortable, need to be able to encourage you to make those kinds of suggestions. And finally, you know that practice is working when your team supports your decisions. May not be the same decision they would make, but they're supporting you. When you say, I need to take a break. We've been really going to lots of therapists for a while now. It's very stressful for our family. I think we as a family, need to take a break. And they need to support you in that and work out a plan on when to reach out and engage you again. Things like that, making you feel like you're being supportive. If you don't feel like you're supportive, you may be hesitant to make decisions. And the other thing that I think that families often have a hard time doing is talking and bringing these kind of maybe sensitive things up. Think about what you want to say before talking with another team member. Make sure you're really thinking it out, especially if it's sensitive, especially if you don't feel that they are providing you with the kind of support you need at that particular time, because you want to feel like you're heard and understood. So you want to talk to them in a way that they are hearing what you're saying and respecting what they're hearing. Your conversations are focused on solutions, not on what they're doing or not doing and what you're doing or not doing. It's, what is the solution? I'm seeing that my little girl is not moving ahead very well in her communicating. We've been using the communication board now for 6 weeks, and she still doesn't seem to be engaged in that process. So what can we do? You may say, I think it might be this. Do you think we need to have only 2 pictures on the communication board? Making suggestions and really having a conversation that leads to a solution, not just a chat. And always knowing what the next steps are. We should always do that after you see somebody. You see your physical therapist on Tuesday afternoon. You want to leave one session knowing what you're going to do in between time and what you will do the next week when you see the physical therapist. What are the next steps that we all need to do in order to help the child reach the conclusion, reach the outcome? That's being part of a team. You really want to feel like you're an equal member. And sharing what you know. Share information about what the child likes, what they dislike, and what they're interested in. All children are interested in things. Some children are interested in certain things more than other things. We want to use those interests in a way that expands their interests. And we can be very creative in using those interests, even though you think it may be the only thing they're interested in. Knowing what kids are interested in, knowing what families are interested in, will help your providers to give you suggestions that are helpful and that fit your child and family. If you don't like to go camping, a provider telling you it would be a great idea for you and your 3 children to go camping for a weekend won't be very helpful, right? But if they know that you love to go to the movies, they may have some suggestions on perhaps going to a movie that is more accommodating to children with special needs or disabilities. Share information about what you do on a typical day. We talked about those naturally occurring learning opportunities. Providers need to know what in your life happens on a regular basis, because those are the things, those are the times, those are the activities that will be a naturally occurring learning opportunity. So you need to share that information. What do you do on a typical day? What do you like to do? What would you like to do, but you're afraid that your child would not be able to participate? Share what's important to you. Perhaps you do like camping, but you're afraid that your child who isn't quite walking yet won't be able to participate. Maybe your therapist will help you work out a solution to that so that you can go out camping. And your little guy that is learning to walk will feel comfortable on the different surfaces. So it's what you do on a typical day, what activities your family likes to do, and what activities you would like your family to do, but you're afraid that the child is preventing you perhaps from doing it. We're here to help you solve those problems, to make sure that your family is doing things that make them happy. Most importantly, when we do give you activities, or when providers give you activities, you want to try them out. If you know you're not going to try out something, tell us. Say, oh, I don't think I'm going to be able to take him to the playground next week, or I don't have time in my schedule to walk him home from school, or whatever the suggestion may be. Provide feedback to us on the type of suggestion that we make. And if you do try out things, how well they worked or didn't work, or perhaps how you did it that may have affected how successful it was. When we talk about documentation in a couple of minutes, we'll talk about a way to write things down so that you're able to share that information on how well things went or how not so well things went. And be open to new suggestions. We as providers need to be open to your suggestions and take them and say, that's a good idea. How can I figure something out? They really want to go camping. Let me figure out how best I can do that to help them. Maybe I need to talk to other people. But when I suggest to you to take your child to the grocery store, be open to at least trying it. At least perhaps you and another adult go and only try it out for 15 minutes, just to see how it feels to you and feels to the child, and how the child responds to the grocery store environment. And you'll know that sharing what you know is working when you provide information about your child during all interactions with team members. That you feel comfortable sharing that kind of information, knowing that they may find that information helpful to coming up with solutions to challenges. You recognize that the activities that you do, the interventions that you do, are customized for your child and family. It's taking into consideration your preferences, your lifestyle, your concerns, your needs. And finally, you will learn new things that are going to be helpful for you. Maybe not helpful today, but helpful down the road. We as service providers, we are supporting you, not just now, but to help you learn how to make decisions throughout your child's lifetime. So you want to feel like you've learned useful information on how to prepare your child to go to kindergarten. What are you going to need to know about when he leaves kindergarten or first grade to go to a higher grade? If he needs a wheelchair when he's 4, when will he need a wheelchair again? That kind of useful information, or to anticipate what's down the line. Identifying family concerns and priorities. We've talked about this a lot. Before you meet with your team, make a list of what you want your child to accomplish or see happen for your family. And come prepared to talk about them. Don't be afraid. Don't be concerned that they'll judge you. They shouldn't be judging you. You want to tell, these are my concerns. I don't like the way he's not eating. I don't like the idea that he spends all his time playing with one particular toy. I would really like him to be able to stay in his car seat when we drive to school. I'd like him to be able to hold my hand when we're in a store. There are many, many things that you want to see happen, that you need to share, that are priorities for you. You want to expect advice and suggestions that are targeted to those concerns and priorities. You don't want somebody to ignore you and start talking about how to get him to say mama or dada, and your concern is staying in his car seat. You really want the advice and suggestions are responsive to you. As I mentioned before, prioritize what you want. We all want a lot of things. Certainly, we all want lots. But knowing how to prioritize and sort of focus on things that are first easy to do so we're successful is really important. Don't try the hardest thing. Try the easy thing so we feel really successful and we develop a whole laundry list of successes. Develop with your team. If you come into your team meeting with a list of concerns and priorities, you want them to help you develop a list that matches the services and supports to meet those concerns and priorities. It could be from the early childhood intervention program. It could be from your school program. It could be from your community in some way. And that your therapists or providers should be able to help you connect to those supports that will help you meet your concerns and priorities. It may not all rely on the speech language pathologist. It could be from a variety of people in the community. And remember, your involvement in the early childhood intervention program or services is to help you learn to do things for yourself, because you're with the child every day, all day. The therapists come and go. They may come once a week, every other week, maybe a couple times a week. But you want to really feel like you're learning how to do things that you need to do to help your child. And you'll know that that practice is working when you feel you're leading the action planning team. That's really important. Eventually, you should be able to feel like you're developing that plan, that you're organizing the meeting, that you're directing that meeting, and not one of the therapists. You feel like you can complete the action steps with little assistance. You can come up with the action steps. Over time, you will learn about your community even more than you know now, and you'll be able to match community supports to your needs, therapy supports to your needs, maybe specific people in your community. There may be a physician who you'll discover is very helpful for a particular concern at a particular time. And ultimately, the actions that you take based on your concerns and priorities will lead to meeting your outcomes, and it's going to be beneficial to you and your family. Okay, so we talked about sharing information. We talked about identifying priorities and concerns, and we talked about being part of the team. 3 clearly things that you control, that you want to feel comfortable with when you meet with your team, to make you feel like you're in partnership with the team. And ultimately, that will be most important for you. So the ECHO map. We talked about the ECHO map. We talked about writing the IFSP. Writing the IFSP or the intervention plan really does require us to be able to participate as an equal team member. So those are 3 things that are action steps on your part that will be very, very helpful in working with your team. The last thing that I want to, we have a couple minutes, talk about is documenting. But before we go there, so we don't miss, does anyone have any questions, comments, concerns, anything you want to share? Does that all sound good to you or not so good for you? All right. So then let's move on. We have a couple minutes. Documenting. I bet you never thought that as parents, you were going to be required to document. You thought that the providers do all the documentation so they can get reimbursed for their services. But you're seeing the child on a day-to-day basis. Your therapist and you work together to come up with some suggestions. And you do the suggestions. They teach you how to do it. You feel pretty good about it. And then throughout the week, you try to do that. You try to do it at mealtime. You try to do it at dressing time, whatever. You need to be able to report back if it worked or not, if you felt comfortable doing it or not, and why you did it. And why you think it may not have worked. So you want to create a system with your providers, and it could be in a notebook. Many of you probably write notebooks back and forth to your preschool teacher. It could be in a notebook that you just handwrite. It could be a much more sophisticated system in which you're collecting data, especially when you want to change behavior. It could be on the computer. You could be texting your providers at the end of every day. You need to develop however you feel most comfortable. But what you want to document is what? You want to be able to document the child's behaviors. Most importantly, the child's response to intervention. If it was suggested that you play with a particular toy during bath time, you want to tell if the child actually responded positively to that toy or not. And your performance. It may be that you weren't sure if that toy was very helpful during bath time because you weren't sure how to provide it to him or what to do to get him engaged. You just seemed to put it in the tub and he didn't do anything. So it could be that you didn't understand what was expected. And if you didn't understand, you could not share that expectations with your child. So you want to document what it is. You want to document how, as specific as possible, be objective. He did not pick up the strips of toast that I put on his high chair. And I gave him 5 strips. He did not pick up any of them. Clear language. I gave them 5 strips of toast as you suggested. He did not pick up any of them. And it may be then you could start thinking about it. Well, he didn't pick up any of them. Maybe 5 were too much. Maybe if I go back and give him 1, he'll pick it up. Maybe 5 words, too much distraction. He was unable to sit still during our family meal when my uncle came and started taking pictures and playing music. You could start thinking, well, maybe he couldn't sit still because he was too distracted by all the activity that was around him. You can take a picture, a video. This is especially relevant if you're working on motor skills, when a child is maybe having difficulty doing a certain motor skill, or does not show the motor skills that they're able to do. Many times when the therapist is asking, do they go up and down stairs, and they won't do it in front of her, but you could take a picture or a video when you see them do that. Documentation can be on paper, it can be a picture, it can be video. You want to try to come up with why you think something worked or did not work. That toy in the bathtub was fabulous. He really loved it. He loved the way the propellers went wiggling, wiggling, wiggling in the water, and there was all splashes. That is really helpful. It tells me as a provider, this little guy likes a lot of activity. He likes things to make noise, to do something. So we would want to give him other toys that he may be interested in that have propellers or like a helicopter or something like that. So we want to document what you wanted the child to do, how you did it as specifically as possible, and why you think it worked or did not work. And this is just a schematic of what you would write. You write a procedure, the results, and the next steps. So you document. When you come back to the team, you talk about what you did, what we want to do next, and what would we need to change in order to make it better. Do I need to change? Do I, as a provider, need to support you, mom or dad, in bath time better so that your little guy is more engaged in bath time? Or do you as a mom and dad have to lower your expectations during bath time? Maybe it's not necessary that your little person has to wash himself with the washcloth, but it tells us what our next steps can be. You want to determine, as I said, how you're going to organize the documentation. You're going to use technology, develop a chart or a graph. Many of you with children that are wanting to change their behaviors, the therapist may want you to collect data. How many times the behavior was done, what you did to make it, to decrease it, and did it work? You want to be able to build that system. Describing the child's performance and the family's performance. Remember, you and your child are doing these things together. The success or failure of an activity may be related to your child. It may be related to you. Your therapist can only help the person who needs the help if that's documented. And we often teach things that, at first it sounds really easy. And then after the therapist leaves, we roll our eyes and say, what did she tell us now? I'm not sure about that. So you want to make sure that you document how the child behaves in addition to how the family behaves. Okay, so to participate in your team, you want to remember that you are essential participatory team members. You are clearly the guides for us as providers, because you know your child best. You learn about him every single day. So you know him better than anyone, no matter how expertise I am. Over time, you should feel comfortable leading the team and not depending on other people to tell you what to do. You want to depend on people to support you in your decisions, give you the information that you need to make an informed decision. And once you're able to do that, your outcomes are going to be based on your priorities and concerns. Definitely, that is key. The outcomes need to be written in a way that you understand, that build upon your concerns and your priorities. And today we specifically talked about some ways of you sharing information with your team, and that's through an echo map to tell them a little bit more about your family. The IFSP, or the service plan, is that document that explains what services and supports you're going to receive, when you're going to receive them, and where you're going to receive them. And finally, we also talked very, very briefly about you figuring out a way to keep a documentation system so that your therapists are giving you suggestions based on data, and not just sort of random ideas, that they really come prepared to respond to the performance of your child and the performance of you that's meaningful. Okay. So questions, concerns, comments. There's lots of you here today. Hopefully you can see how we're building upon each week on more and more information. Next week, which is our last week together, we are going to talk about very specific things that you can do in everyday activities. We're going to talk about mealtime, bedtime, playtime, things that you can do, how to use routines and everyday activities to your advantage, and for taking advantage of them as learning opportunities. So if there's no questions, we'll see you next week at 2:30 on Wednesday. And hopefully some of you have been here every week. We would really love your feedback. I'm sure that somebody has put the link to the evaluation in the chat. Please fill out the evaluation. We really do appreciate that information that we get. And
Thank you so much, Dr. Toby. This was very informative. And thanks
Thank
everyone
you.
for joining the session and making time here today. Again, you will find 2 links in the chat box. One of them will be your feedback, as Dr. Toby mentioned. The other one has a copy of the slides in both Arabic and English. And we look forward to seeing you next week, inshallah.
Great. Inshallah.
Thank you, everyone.